EFL studio tonight. We're talking to Dr. Owen Gabriel and Dr. Albert Titus, and later we'll be joined by Dr. Winston Paris. Before we start, I'd like both doctors to tell us a little about themselves and their specialization so we can understand what they do more clearly. So, Dr. Gabriel, let me start with you.
Okay, I mean, I think most of this is already known, but I practice medical oncology, which is a specialization dealing with the diagnosis and treatment of cancer. And certainly this is a new field in medicine overall, let's say, as far as specializations in medicine are concerned. I mean, surgeons have been around for ages, and certainly we're still understanding cancer, and we haven't fully found all that is relevant to it. And in St. Lucia, there have been few real attempts at managing cancer as in a specialized way. So in the oncology center, which is a private practice that I run, and through the public sector clinics that I do at the Victoria Hospital and elsewhere, what we do is see patients who have been diagnosed with cancer and plan a treatment schedule for them, whether that includes chemotherapy over a number of months, or radiotherapy, which is given overseas, or surgery, or a combination of these three in whichever format possible. Generally, this involves working with a number of other specializations, including the pathologist, the radiologist, the laboratory technician, the oncology nurse, obviously the surgeons and the radiation oncologist, and the families and the patients and the social worker and so on. And it's a field that is, in a way, if you're able to achieve one person's a positive result in one person, that brings fulfillment. And although a lot of people complain that it's a field that is quite depressing, and but we know that we've had good outcomes, and good outcomes are possible once we're able to work together, and we're able to identify disease in its early phases, and we have all the influences of all our specializations coming together, harmonization of effort, and we're able to implement the techniques of more updated medicine, state-of-the-art medicine. We get good outcomes.
Okay, and you've gone into something else. But that just to show how passionate you are in making it very clear to people that one physician alone can't do it on their own. Dr. Titus, tell us about you, please.
Well, I am visiting from St. Croix in the United States Virgin Islands. I'm a board-certified general surgeon. I practice adult and pediatric general surgery. I also do endoscopy and colonoscopy screenings as well. And
what's that?
It's we're using cameras and tubes to get inside the intestinal tract to diagnose diseases and detect early cancers and so on. And I also specialize in minimally invasive surgery, or laparoscopic surgery, where we use really small incisions to perform advanced surgery, like removal of the gallbladder, colon cancers, fix hernias, do those kind of, remove spleens, remove other organs that we can do, use this advanced technique to do. And so that is where surgery has come, and that's where it's I'm trying to help this community advance in that direction, since that is not something that's done very commonly here. So I'm presently working with 2 surgeons, one here in Castries and one in Beaufort, to help train them in these minimally invasive techniques so that we can bring those advanced techniques to St. Lucia.
You know, you say all that with a smile on your face, and I'm thinking, to me, it's gory. The work that you do is just gory, but each to his own. And I've spoken to certain doctors who actually like when they've got these, I hate to say challenges, but they really like to know that they're going to help. Doesn't matter what stage their patient is at. And it just seems that sometimes the worse the situation is, if you have a good doctor, it seems the more they want to get to the bottom of this. But I mean, I have to say, when we announced that we were going to do this program, a lot of the St. Lucian public couldn't understand why one doctor, and I don't know whether it's because people are not used to modern medicine or the way things work, they couldn't understand why one doctor couldn't diagnose and say, okay, this is what you have, go and see one specialist. Why are so many people involved? And some people also say it's just a matter of the doctors are helping the other doctors to make money. You know? So this is what we are dealing with. So, Dr. Gabriel, if we start from the beginning, what is it that people have to understand when it comes to medicine, in terms of getting your diagnosis and all the physicians who are likely to be involved? So we actually have to go to a break, but when we come back, I'm going to have to repeat that, because I think that it's something that we need to start from the beginning so that we can get our viewers to understand why it's so important that everyone, not just the physicians, work together. So let me just repeat our giveaways tonight. Name the 3 most common cancers in St. Lucia. Name the 3 most common cancers in St. Lucia. If you're correct, your name is drawn out of the bag, you will win a free medical checkup with Dr. Gabriel. What is the recommended age for your first screening colonoscopy? What is the recommended age for your first screening colonoscopy? The prize, a free screening colonoscopy for someone of that age by Dr. Burt in Vieux-Fort. What is the most sensitive and precise procedure used in screening for colorectal cancer? What is the most sensitive and precise procedure used in screening for colorectal cancer? And the prize there is free screening colonoscopy for someone of that age by Dr. Daniel in Castries. The questions can be found on dolorfactorlive.com and Facebook, Dolor Factor Live TV show, and on our BBM profile. When we come back, we may talk to Mr. Dr. Winston Paris at this stage, or perhaps a little later, but he's going to be with us. So stay with us, and of course, if you listen carefully, you'll get the answer to the questions. So stay with us on DBS. We'll be right back.